Okay, I'm going to talk a little bit now about IVF when it's successful. So if you've got a successful positive pregnancy result, that's brilliant, amazing. So acupuncture is still very good for you to come for the first trimester, which I will talk about in a separate video. But to just kind of, sometimes people don't really know what happens next. So basically you will quite often be offered a 6-week scan. So sometimes they just give you a home pregnancy test and you take that, and that might be confirmed with a blood test. It just depends what your clinic protocol is. And then you will be offered a 6-week scan, which is great. So that's a viability scan. And then if you see a heartbeat at that 6-week scan, your chance of miscarriage really drops significantly. And then you get to the 12-week scan. You can pay for a harmony test just before this, which is a much more in-depth, comprehensive scan. I think they cost about £300 at the moment of that I'm saying this. And you can get that before the 12-week scan if you want extra further reassurance. It's more comprehensive and it's in 3D. And once you get to the 12-week scan, then basically you are released into normal midwifery care, and everything should just proceed as normal at that stage. So my IVF patients, I do ask them to come in the first trimester. I like to see them every week. Actually, all pregnant women, I like to see them in the first trimester every week for the first 12 weeks. Then in the second trimester, I see them much less often, and quite often they come for massages as well as acupuncture, or both together, which is really nice. And then at the end, towards the third trimester, then you're starting to get heavier, starting to get more issues. And then I do tend to see people more often. But if you are an IVF pregnancy and you're just at the beginning, you're probably not thinking right now about the birth, but they don't really want people with IVF pregnancies in this country to really go above their due date, to go beyond their due date. So if you are under 40 and your pregnancy has been healthy, then sometimes you can negotiate with your consultant around that. But if you are not feeling comfortable about that, or if you're over the age of 40, then it's a really good idea to start coming for some pre-birth cervical ripening acupuncture, and to come for that regularly from week 35. I start to see my IVF ladies, and I see them once a week, and we start doing cervical ripening points, which really help to nudge your baby along, give it a little whisper, a little friendly little push. And then if you do end up getting induced, hopefully not, hopefully the acupuncture will help you to deliver before your due date. But if you do end up getting induced, it can often make it a much more I believe the word is efficient, if that's the right word for labour. So can make it more efficient. So if you get induced, that is much more likely to work with the first thing that they offer you, which is a pessary, but I won't go into that now. So anyway, acupuncture is really safe and beneficial for you and for baby all the way through your pregnancy. And for IVF ladies, it's especially important to come at the beginning and at the end.